vaccination. Because what the cell lines do is most flu shots are made from eggs. President Bush back in 2005 allocated more than $7 billion to the drug companies to build new flu shot factories using something called cell lines. And the cell lines are made from dog kidney cells, insect eggs, and retinas from aborted fetal tissue. Retinas from aborted fetal tissue. Those cells grow rapidly, and because they grow rapidly, the viruses can grow and divide rapidly. So instead of just harvesting one flu shot lot per year, they can do a flu shot run line every 6 weeks. But those cell lines used by Novartis have only been used in a limited way in research in Europe. They've not been approved for use in the U.S. In fact, the cell line factories have not even been completed being built yet in the U.S. There is scant information about the AS03 and the MF59, even in use in Europe. Remember, I said that the AS03 is experimental, and the MF59 has been used in some limited ways in flu shots in Europe, only in people over 65, and only one study that was done in children. So there's a very limited use information for that, and it's not approved for use here in the U.S. And the European Medicines Agency, which is the EU's top regulatory body, sort of akin to the U.S. FDA, is fast-tracking the approval process for the swine flu vaccines to have an order before winter in Europe, even though Baxter and GlaxoSmithKline have been given complete immunity in the UK because they flat out said that they were not going to produce any vaccines unless they were given complete immunity in Europe, just like the complete immunity that the other drug companies have been given in the U.S. So now that kind of brings us to probably the main topic of the night, and probably the $64,000 or maybe the couple $1 billion question, which is, will all of these things become mandatory? Will we be forced against our will to take this vaccine? Will they line us up and tell everybody to roll up their sleeves? Will they be going door to door? It's at this point, as of today, when this webinar is being recorded on July 27, 2009, the federal law is really rather vague on whether the government is going to have the right to order mandatory vaccination. And when I say vague, it really is vague, and believe me, I've read a lot of it. Now, I'm not a lawyer. I don't know what Mayor could pipe in and say about this, but I do know that what is said is that it's really rather vague. It depends on the severity of the emergency. It depends on how many people are actually getting sick. It talks a lot of the transcripts that I've read talk about using partnerships and cooperations with the states, because state laws are really governed by, or vaccination laws are really governed by state laws. And the state government talks a lot about partnerships and cooperation, and the vaccination campaigns will definitely be done at the state level, like we already talked about, using schoolhouses and probably firehouses and things like that. So in order to encourage the states to participate with this mass vaccination plan, states and territories have been allocated to receive $260 million to bolster their vaccination capabilities and programs. And all of us know that many of the states are cash-strapped, and this will be a great boost into their economy. There's an additional $90 million that has been set aside for hospitals because they're anticipating a big boost in the number of people who are going to get sick. So there have been in the new health care plan that hasn't been passed yet, but there are provisions in the new health care plan for people to go door to door and assess your vaccination status. Are you losing weight? Are you staying on your medications? Are you checking your blood sugar? Are you exercising? Oh, how secure are your windows? Do you have leaks in your windows, or are you really doing things that are environmentally conscious in terms of securing your heating and cooling systems in your home? Do you have leaks in water in your home? Is the water remained fluorinated? Because fluorinated is very good for you, and there's an entire fluoridation provision in this health care law. If any of you have not read it yet about what they're actually trying to vote on and kind of cram down our throats in Washington, I highly encourage you to go out and find the bill and read it. Don't read it before you go to bed at night, because you probably won't sleep very well. And We don't need health care reform in this country. We need insurance reform. We need the insurance lobby reform. We need medical malpractice insurance reform. We need to not have all, there's something like over 1,200, maybe even more than that, different insurance companies. They all have different forms and policies. We need to get people to get health insurance that's affordable, but not at the expense of businesses. And one of the provisions inside of this health care law is that if small businesses, even businesses that have 8 or 10 employees, and they're saying that it's going to increase the amount of money expended by small businesses by more than 18%. But if you don't provide government-funded health insurance for your business, and I'm sure there's a lot of business owners on this call, that you could be fined up to $100 per day per employee until you get the health insurance in place, and that will be allocated to you as a government tax. So this is not a good thing. Do we need reform? Do we need to have better things going on in this country? Yes, we do. But I heard on the radio this morning someone who said, it was a physician on the radio who said, it's interesting that President Obama seemed to take a longer time to pick out his dogs for his girls than he is for making sure that everything is right in this health care policy. So I think that's something to sort of think about as you're getting active. So what's going on behind the scenes in all of this stuff? There's some things that I've been privy to because of the circles that I run in that I really wanted to share with the people on this talk. There is an International Swine Flu Summit that's actually going on August 19th through the 21st in Washington, D.C. I was actually invited to that as media because I attended 2 of those conferences in 2007 on the Bird Flu Summit. It's put on by the same company called Newfields. It's the first International Swine Flu Summit, and these are the things that they're planning to discuss behind closed doors at that summit. And one of the reasons I very much wanted to go, they're talking about how do you overcome a reduced workforce of 40%, how to manage interruption in food and fuel and essential supplies, how to manage mass public panic, how to implement training programs for fatality management, how to conduct morgue operations, how to conduct final disposition of bodies, how to effectively apprehend, examine, and release people who are suspected to be ill, how to effectively undertake mass vaccinations, how to enforce quarantines, how to effectively transform schools and facilities into shelters. This is a major big deal. And this came right off of their 6-page flyer telling what all these breakout sessions were going to be. I got a personal invitation from them to come as media to this conference. And if anyone wants to read this for themselves, you can go out to Google and you can put in International Swine Flu Summit into Google anytime, and you can pull up this PowerPoint or not a PowerPoint, it's a PDF flyer, and read it for yourself. When I started reading these things, it's like, wow, I really want to see what they're planning. So I submitted all the appropriate paperwork. I have a press pass from News of Views. I submitted that. Remember, I've gone to these same conferences by the same company twice before, and I had an invitation. 10 days of going back and forth with them and writing letters, writing emails, and making multiple phone calls a day. They finally sent me an email that said that they, after a lot of consideration, and a lot of phone calls and a lot of emails, we had to decide whether or not they were going to allow me, little old me, to come to this conference. And what they actually said in this email was, based on the letter of intent submitted and profiling of the interested media, our CEO was not able to decide in your favor, which means that the media is being profiled, the media is being censored, liberal media is not being allowed to go to that conference. One of the stories that I got was that 26 different media outlets submitted an application and they only accepted 3. Other ones, so this is another thing that's going on behind closed doors in terms of what's happening to make decisions about what's going to happen to us down the road. So with that, I think that we've got about 20 minutes left for questions. I don't know, Mayor. Is there some place that we need to go with this now? Where how do I don't see any questions. So.
Sherry, I'm never going to have you on at night because I'm not going to sleep tonight. I think I know a lot. You've taught me so much in the last 40 minutes. I mean, this is really, really scary. I think that's really the bottom line. You know, we've got. Oh, I'd say we have about 110 questions, Sherry. So, you know, and Karen's been writing down.
Oh, one more thing I just want to go through really quick. Mayor, I want to say this.
But I think we need to get to a few of the questions. But whenever we have time, and it may not be on a Monday or Wednesday night, we can come back just for questions and answers. I mean, this is scary. This is just really, really scary.
The one last slide I didn't put up here I want to go through with everybody really quick is that, you know, some of this may be really scary or some of it may just be a repeat of history. We did the same thing in 2007 over bird flu. We said that it was in 40 countries and 270 people died. And HHS, Department of HHS allocated $132 million for pandemic flu vaccines for bird flu. They were given, the pharmaceutical company was given complete immunity. President Bush allocated $1.2 billion for pandemic flu preparedness. Tamiflu stock and Tamiflu went right straight through the roof. So how many more billions of dollars do we as people need to pour into the pockets of the pharmaceutical industry over either a perceived or their reality of what's going to happen to us? And I would love to have the opportunity to come back and just do a question and answer mode on this some night, because this really is a scary proposition, and it's happening in real time. It's really happening in real time.
You know, one of the best pieces I saw from you, and so much of your work is outstanding, and I'm going to post it everywhere, is the you brought together all the data to show that the flu vaccine has never worked. And I make actually like because a lot of people have asked that question also. The flu vaccine has never worked in any age or ever. And can you address that, Dr. Tenpenny?
Yeah, I really can, and they can go out and Mayor, I'll give you this. I'll send it to you so you can have it on your website too. I think Nick has it on medicalvoices.org. If not, I'll make sure he has it. I've got it on drtenpenny.com. It's on pandemicfluonline.com. It's a 2-page PDF file that actually shows the research that it says that flu shots have never worked in babies. Flu shots don't work with kids with asthma. In fact, the statistics show that if you get a flu shot to kids with asthma, you increase their risk of going into the hospital. Flu shots don't work in middle-aged adults. In fact, if you take a population of vaccinated versus unvaccinated adults, the unvaccinated or the vaccinated adults only miss 0.16% fewer days of work than the ones that get flu shots. So people say, oh, I need to get my flu shot so I don't get sick. You're not going to be any healthier than ones that don't get flu shots. It doesn't work in the elderly. It's shown unequivocally that media and marketing is more effective than in the elderly. So it doesn't work anywhere. And I'm really surprised that some really smart lawyer somewhere doesn't figure out that this is fraud and abuse, this is waste of taxpayer dollars, that we are using a substance on the elderly and using Medicare dollars to vaccinate them, and it doesn't even work.
The problem is, just so you outlined a little bit earlier, I'm not a smart lawyer. I mean, I am a lawyer, but you know that's only later on in life I got my degree. Even though I'm in lots of lawyer circles also, and that is, what are you going to do as a lawyer? They have total immunity, and what you brought up I thought was phenomenal. That they have not only no incentive to do studies on safety, but they could be damaging because the studies can be used against the drug manufacturers as being
willful intent.
Willful intent. You know, Carrie, you know, we got some very good questions here. So why don't you go ahead?
Okay, I'm going to go with the first one that kind of would affect everyone, and it's people want to know about boosting their immune system. One, if they felt that they had to take the vaccine, which we're going to try and avoid with all of our power. But even if we don't end up taking it, and this disease, the swine flu comes around this fall, give us some tips for boosting the immune system.
Well, obviously, some of the most important things you can do are some of the simplest. I mean, I know that Mayor talks a lot, and we've talked about on these webinars before, about increasing your vitamin D level. I mean, getting your vitamin D level up to, 5,000, 10,000 units, and if you start to get sick, take 50,000 units for a couple weeks. You're not going to hurt anything. This whole idea of vitamin D toxicity has been so overblown that we've made everybody deficient.